Hello everyone. Today our topic is the fatigue. It's very important chief complaint. It's high yield. It shows up in the exam all the time. So initially, as we said, we ask about the questions, the onset. Is it frequent? Is it all the time? Anything made it better? Anything made it worse? And then we go to past medical history, family history, social history, and we go to the differentials afterward. So the differentials, what are the differentials? Could be adjustment disorder, could be apnea, could be, which means lack of breathing, obstructive sleep apnea. It could be a cancer, depression, diabetes, hypothyroidism, Sheehan syndrome, anemia, PTSD, post-traumatic stress disorder, myasthenia gravis, and infections. So each of these chief complaints, there are questions that we have, specific questions for each one of them. Okay, so let's talk about infection. Infection, what do you ask about? It could be a TB, infectious mononucleosis, and could be HIV. So these three could cause fatigue. For TB, we have the four questions, the PPD, when was last PPD exposed to anyone with similar contact, N for night sweats, T for travel, have you traveled recently? Infectious mononucleosis, two things, sick contacts and abdominal pain. HIV, three things, L contacts, IV drug abuse, and uh, sexual behavior. So for myasthenia gravis, two important questions. How does it progress during the day? Okay, this is very important because for myasthenia gravis, it gets worse throughout the day because the nicotinic receptor get depleted. The second one, have you noticed any weakness of the muscles or any double vision? Okay. For PTSD, have you experienced any nightmares recently? Okay, any nightmares? For anemia, three questions. Number one is that have you noticed any changes in your skin color? Have you noticed any shortness of breath on exertion? Have you noticed any excessive bleeding from any side of your body? Okay, this is for anemia. For pituitary gland Sheehan syndrome, we ask, was the delivery normal or there was any excessive bleeding? Was there any excessive bleeding? Okay, this usually happen after pregnancy, after delivery. After delivery, you have excessive bleeding, postpartum hemorrhage, and this postpartum hemorrhage deplete the blood supply to the pituitary gland. So the pituitary gland die. So you no longer have pituitary, and pituitary is the source of androgen, cortisol, adrenaline, the one that keeps us working. So if you have no pituitary, you feel tired. Second one, have you been able to breastfeed your child? Okay, because the Sheehan syndrome causes inability to do lactation because the prolactin and oxytocin hormones will be affected too. Okay, so this is the pituitary gland. For hypothyroidism, this is important too. So we ask any temperature intolerance, any skin changes or bowel changes, those are important ones. For diabetes, we ask, do you feel more thirsty than usual? This is one. And frequent urination. So frequent thirst and frequent urination. For depression, ask about how are you feeling? Okay, if you're feeling sad, then you do SIGICAP. For SIGICAP, which is the sleeping, interest, guilty, energy, concentration, appetite, psychomotor retardation, and stress. For cancer, have you noticed any pain in your belly or weight loss? Okay. For apnea, do you snore at night? This is important. Or has someone told you that you were snoring? Do you feel restless at night? Or has someone told you that you feel restless, like the partner? Okay, so this is the thing. This you see, this is fatigue, low battery. For adjustment disorders, stress Usually, do you have stress? Usually, within time, it would be more than 1 month, because if it's within 1 month, it's acute stress disorder. If it's after 1 month, this is adjustment disorder. Okay. And there's an important question we ask: have you noticed any problem performing your daily activities like bathing, dressing, cooking? Was there any event associated with this fatigue? Okay, this is important too. Okay, so this is the summary for fatigue. What do we do? So just to review really quick, for fatigue, there are different causes. Could be psychiatric like PTSD and adjustment disorder. It could be endocrine like Sheehan syndrome, hyperthyroidism, and diabetes. Okay, could be cancer. Okay, hematology, anemia, cancer. Could be infection, and myasthenia gravis, autoimmune disease. We can group them this way. Psychiatric, add depression to it too. Adjustment, PTSD, depression. Okay, so it's like that. Psychiatric, endocrine, and others, let's say. Okay, psychiatric is the adjustment, PTSD, and depression. Endocrine, hypothyroidism, and also the Sheehan syndrome, and the diabetes make you tired. And the third one, others, myasthenia gravis, make you tired, anemia, and cancer. Okay, so this is about depression. This is summary of depression. Now we will discuss another chief complaint, which is sleep problem, insomnia. Okay, so insomnia, what are the differentials for insomnia? Sorry, before we go to the different one, let's just do a physical exam with depression. What do? We do hint. Okay, head, ear, eye, nose, throat, thyroid exam, and we check for orientation. The investigation, we do complete blood count, CMP, TSH, T3, T4, monospot if we think infectious mononucleosis, infection with the other two, but that. ELISA, chest X-ray, okay, acetylcholine receptor antibodies, this is for myasthenia gravis, and CT scan of the brain, MRI of the brain. Okay, we do these things. For sleep problems, what do we do for sleep problems? There are different differentials. Could be obstructive sleep apnea, could be stress, could be drug abuse, could be hyperthyroidism, circadian rhythm disorder, or could be caffeine. Okay, so these are the differentials. So first we ask about how long you've been having trouble sleeping. It's very common, by the way, sleeping problem. And anything started it, anything made it better, medical history, social history, family history, this is for everyone. And there are questions important. What do you do before you go to sleep? What time do you usually go to bed? Okay, this is important for circadian rhythm. Have you noticed any trouble falling asleep? Okay, do you wake up at night during sleep? How many times do you wake up? What time do you wake up in the morning? Do you feel sleepy or take naps during the days? Okay, so these are these types of things. For example, like there's sleep hygiene too, like if people like eat before they sleep, or like they're using bed, like you using bed only for sleep. That's another one important. Like this is one of the recommendation counseling for them. Okay, so it could be sleep hygiene too. People eat and then go to sleep, or work out and go to sleep too. So for other differentials, obstructive sleep apnea, do you feel restless at night, or someone told you? Snore at night, or someone told you? So restlessness and snoring, these two things for obstructive sleep apnea, remember, always the same. For stress, have you not had any stress recently? For illicit drugs, do you consume caffeinated beverages? If yes, how much? Okay. For hyperthyroidism, we ask any difficulty tolerating temperature, cold or hot temperature, any changes in your bowel movement, and for circadian rhythm, okay, you ask any, it's called delayed sleep syndrome. People sleep at 6 p.m., wake up at 6 a.m., or like there's abnormal hours of sleeping. Okay, this is circadian rhythm. Usually when jet lag, like people travel a lot. Caffeine. So this is how we ask about it. So this, for another one, for circadian rhythm disorder, these questions for circadian rhythm, sorry. So we ask, there are different types. There is one that delayed sleep syndrome, like sleep at 6 p.m., okay, early. And there's one advanced sleep syndrome, sleep at 2 a.m. And jet lag, maybe I mixed these, I don't know, I'll check and get back to you. Jet lag, history of recent travel, okay. Okay, and this one for caffeine. Caffeine, do you take coffee before you go to bed? This is important, obviously. Have you noticed any tremors of your hand? Okay, and have you noticed any racing of your heart? Okay, these are the things for caffeine. Okay, so just a correction, like the delayed sleep syndrome is the one that sleep at 2 a.m. and the advanced, like it's delayed by 2 or more hours than the usual sleep time. This is delayed. The advanced is the one that sleep earlier, like 2 or 3 hours more than the usual bedtime. Like for example, at 6 p.m. sleep at 6 p.m. Okay, so I corrected that. Advanced is the one at 6 p.m. Delayed is 2 a.m. There was a mistake here. Okay, so this is for sleep problems. Okay, we knew what questions to ask. After that, we do head, ear, eye, nose, throat exam and heart exam. Hint and heart. The investigation CBC, CMP, TSH, T3, T4, urine toxicology screen, and cortisol level. Okay. So for the differentials for sleep problems, again review: obstructive sleep apnea, stress, drug abuse, hyperthyroidism, caffeine, and circadian rhythm. Okay, so if we want to group them, caffeine and circadian rhythm, this together, hyperthyroidism, obstructive sleep apnea, and stress together, and illicit drug abuse finally. Okay, so here's the summary of the sleep problems, insomnia. Thank you so much for listening, and we'll see you in the next class.